Welcome to my channel, my respected friends and viewers. Today's presentation, explores the growing role of mental health in workplace absenteeism and productivity loss across Australia, Canada, and United States. Our goal is to highlight not just the data alone, but also the underlying psychosocial and environmental factors that derive these outcomes. By looking across three advanced economies, we can see both commonalities and regional differences, giving us a clear picture of how work practices, community support, and government policies interact. Ultimately, this isn't just about numbers, it's about the human impact of stress, anxiety, and depression on workers and their families, and how thoughtful preventive strategies can reduce both sufferings and economic costs. By the end, we will look at the actionable workplace and family practices that can ease the burden, improve mental health, and restore productivity. So let's dive in today's vlog: workplace mental health factors and productivity impact, a three countries comparative analysis. First, the Australian context, a system under strain. Mental health related workers' compensation claims are rising by approximately 10% annually. Claims among 30 to 40-year-olds jumped by 730% from between 2013 and 2022. Psychological issues account for about 33% of new disability support pension recipients. Welfare frauds rates remain very low, less than 4%. The data from Australia reveals a system under severe and growing pressure. We are seeing a dramatic surge in former claims, particularly in the prime working age population, indicating a deep seated issues within our work environment. The fact that a third of new disability pensions are for psychological conditions underscores the severity of the impact. In Australia, mental health related workers' compensation claims have surged, growing by almost 10% annually. The sharpest rise has been among the middle age group, 30 to 40 years old. Claim increased by astonishing 730% between 2013 and 2022. This signals that work age adults who are often juggling both career and family responsibilities are under immense pressure. Psychological conditions now represent about a third of the new disability support pension recipients, showing that the issue is long term and not just episodic. While welfare fraud often gets media attention, it's important to note that actual convictions are very rare, about 4% of recipients. This suggests a much bigger problem is not fraud, but the genuine widespread mental health burden that is impacting work participation and the nation's productivity. These statistics reinforce the urgent need for preventive strategies and supportive workplaces, systematic rather than individual responses. Canada. Mental health is approximately 30% of disability claim, but approximately 70% of total cost. WCB mental disorder claims doubled from 2012 to 2022, PTSD approximately 50%. Almost half a million Canadians miss work weekly due to mental illness. Fraud not tied to mental health, self reported disability fraud slightly higher. Canada shows a slightly different but equally serious picture. Mental health is now the leading cause of disability claim, accounting for around 30% of all claims, but an even larger share of cost, nearly 70%. This is because mental health related absences are often longer and more complex to manage than physical injuries. Workers' compensation claims for psychological conditions have more than doubled since 2012, with post traumatic stress disorder making up nearly half of those cases. Every week, about 500,000 Canadians miss work due to mental illness, highlighting the scale of disruption. While fraud exists, it is not disproportionately linked to mental health conditions, and rates remain relatively low. The takeaway here is that Canadian workers or workplace face a major productivity drain from mental illness, and policies must focus more on prevention, early intervention, and creating psychologically safe workplaces. USA. Mental health related employee leave surged by 300% between 2017 and 2023. 40% of workers' compensation claims are now linked to stress. Mental disorder constitutes 18% of all Social Security disability insurance awards. SSDI improper payments are minimal, less than 6%. Um, in the United States, mental disorders account for 18% of all Social Security disability insurance awards, making them one of the largest categories of disability benefits. From 2017 and 2023, mental health related employee leaves surged by 300%, indicating a sharp rise in workplace strain. Stress alone is now linked to roughly 40% of workers' compensation claims, reflecting the heavy impact of burnout, high workloads, and job insecurity. Despite these large trends, improper payments or frauds within the social security system remains very small, which shows that the overwhelming majority of claims are legitimate. What stands out is that while mental health claims make up less than 2% of all workers' compensation cases overall, the financial and social costs are disproportionately high. This suggests US employers need proactive strategies to address stress before it escalates into long term disability. Some attributes it to limited official recognition of work related psychological or psychosocial risks, a policy gap that this data suggests urgently needs to be addressed. Unified root cause. So let's look at some of the common issues. Job strain, high demand plus low control increase mental ill health risk by 75 to 100%. Effort rewards imbalance feeling undervalued nearly doubles the risk of depression. Increase risks by 24 to 44% if there is low support and bullying. These hazards are interconnected and often combined to create higher risks. WorkSafe Australia's hazard guide model lists 14 factors those can trigger mental illness and productivity impact, which must be regularly checked. Looking across the three countries, Australia, Canada, and United States, several common threads emerges. High stress, burnout, and unrealistic workloads are top drivers of mental health related absenteeism. Another shared factor is stigma. Employees often delay seeking help due to fear of judgment or career repercussions, which only worsens outcome. The rise of remote work, while beneficial in flexibility, has also introduced digital fatigue, isolation, and blurred boundaries between work and personal life. Gender and age disparities are also striking. Mental health conditions disproportionately affect younger workers and women, who often carry both workplace pressures and family responsibilities. These shared challenges highlights that while the statistics differ across countries, the core drivers are remarkably similar. That means solution like tackling stigma, creating healthier work culture, and supporting vulnerable groups can have wide cross-border relevance in reducing mental illness and productivity loss. The 14 factors that need to be identified, assess, control, and monitor includes high or low job demands, low job control, poor support, lack of role clarity, poor organizational change management, inadequate reward and recognition, poor organizational justice, traumatic events, remote or isolated work, poor physical environment, violence and aggression, bullying and harassment, poor workplace relationship and interaction, and lastly, work logistics. The study was by the University of Sydney provided overwhelming evidence. The combination of high job demands and low decision making control, known as job strain, increases the risk of mental illness by as much as 100%. Strategic solutions, targeted risk control measures. uh, Job strain, high demand and low control. In other words, more responsibilities and less authority. Implement flexible work arrangements, empower employees with task autonomy, redesign roles for more decision making latitude. Efforts reward imbalance, ensure fair and adequate recognition. Low support and bullying, train managers in mental health awareness and supportive leadership, enforce zero tolerance anti bullying policies. Role stress and poor change management, provide clear role descriptions and responsibilities, manage organizational change through proactive, transparent communication. Knowing the root causes allow us to move from generic advice to precisive or prescient interventions. We can now map specific evidence-based control directly onto the key hazards. To combat job strain, we must actively increase employee autonomy and flexibility. To fix effort reward imbalance, we must ensure fairness and recognition are baked into our system. For low support and bullying, manager training and unequivocal policies are non negotiable. And for the anxiety of role stress and poor change management, clarity and transparent communications are the antidotes. This table provides a clear blueprint for action, transforming the abstract concept of healthy workplace into a practical set of managerial and organizational responsibilities. Building resilient communities beyond the workplace. Foster open family communications, encourage balance between digital and physical activities, supportive community networks to buffer stress, in promoting resilience through education and coping strategies. While the primary duty lies with the workplace, mental health is not shaped by work alone. It is also deeply influenced by family and community life. Open and supportive family communications can act as a buffer against stress, but breakup and family domestic violence will fuel it further. In such environment, helping individuals feel less isolated in crucial. um, Encouraging balance, such as reducing excessive screen times and promoting physical activity, can improve resilience, especially for children and young adults. At a community level, support networks such as local groups, peer circles, or cultural organizations can provide a sense of belonging that counters loneliness. Education about coping strategies and resilience building, whether in schools or through public campaigns, help normalize mental health conversations. These family and community practices complement workplace initiatives, creating a holistic safety net. Together, they ensure that individuals have multiple layers of supportive, reduce support, reducing the risk of mental illness, becoming severe enough to lead to disability long term work disruptions. The references used are on the screen. Please feel free to consult them to dive into further details and know about the topic. Um, Thank you for watching. With this comes to the end of my today's vlog. Subscribe if you find it useful and share with your friends and family members if you think they may be in need. And stay tuned for the next vlog on managing depression and stress. Till then, look after yourself, stay healthy. Bye bye for now.